If you or someone you love is going through IVF, you may have heard about adding growth hormone to your protocol, especially if you are a poor responder or you've heard that you have diminished ovarian reserve. Maybe your doctor's brought it up. Maybe you've read about it online. Maybe a friend used it with their IVF protocol and had good success. And you might just be curious if it's something that you should add for yourself. So today we're going to go straight to the science and look at the evidence and try to answer the question, does growth hormone improve IVF outcomes? I'm Dr. Lora Shahine. I'm a double board certified OBGYN and reproductive endocrinologist. I'm an author. I'm the host of the Brave and Curious podcast, and I love educating. I've been helping people with IVF for over 20 years. If this is your first time finding the channel, welcome. I'm so glad you're here. Be sure and subscribe. And if you're coming back to the channel because you found something valuable and educational, welcome back. I'm so glad that you're here. There's two other ways to stay in touch and get education information. Number one, you can sign up for my newsletter. It's in the description below. The link is in the description below. And number two, you can listen to my Brave and Curious podcast with in-depth interviews and topics all about reproductive health and beyond. Now, today we're talking about growth hormone and whether it can improve IVF outcomes. First, we're going to go through exactly what growth hormone is, where it can be found in the body. We're going to go through why, theoretically, adding it to an IVF protocol may help with IVF outcomes. Then we're going to go through the evidence, and we're going to go through multiple studies. I'm going to show you exactly what has been found. Finally, we're going to recap at the end, and I'm going to leave you with questions to ask your doctor to see if growth hormone is something you should add to your IVF protocol. Remember, your doctor knows you best. This is educational information, and you've got to talk to your doctor about your personal health situation. So first of all, what is growth hormone? It is a peptide, 191 amino acids. It's made in the pituitary gland, which is a little gland at the base of your brain. It is mainly thought of its use in childhood height development, but it is actually important into adulthood as well. Growth hormone is important for building muscle mass, bone density, regulating metabolism, and it's important in reproductive health. And there are growth hormone receptors throughout the uterus and in the uterine lining, the endometrial lining, where embryos implant. We know that women with growth hormone deficiency can have difficulty with fertility. There have been animal studies that have blocked the receptors for growth hormone and shown that animals will then have difficulty with fertility issues. So the biologic plausibility of adding growth hormone to an IVF cycle makes, again, biologic sense, but that doesn't mean that adding it improves outcomes. If you're going to take growth hormone for your IVF cycle, it'll be in the form of a recombinant form that's made in a lab, and you take it in liquid form of a little subcutaneous injection, and you take it in addition to the rest of your IVF medication or IVF shots for your protocol. So it's important to know if you're adding something, especially if it's an out-of-pocket cost and it could be quite expensive, you really want to know, is it worth that extra shot? Is it worth the extra cost? Is it really going to have a benefit in your personal situation? That's the question that we're going to answer today. But first, more about the theory as to why adding growth hormone might be helpful for reproduction. Remember that during an IVF cycle, we're taking shots. We're using gonadotropins. They're follicle stimulating hormones and luteinizing hormones. The brand name for these are Gonal F or Follistim, Menopur. So those are the brands you can find in the United States, but there's many more. These are follicle stimulating hormone and luteinizing hormone that your pituitary gland makes every month in order to recruit one egg. You're taking these shots in order to recruit multiple eggs. IVF is an efficiency model, and statistically, if you have multiple eggs retrieved, you have more embryos and be able to find normal embryos and have a higher chance of success with one egg retrieval. Growth hormone is thought to work alongside FSH and LH to enhance the ovarian response, especially in an IVF cycle. And there's four main ways. So theoretically, growth hormone should increase intra-ovarian IGF-1, and that might help granulosa cells and the cells supporting around eggs be more sensitive to the other gonadotropins that you're using. Number two, growth hormone should promote follicular development and egg maturation. Number three, growth hormone should support steroidogenesis, or the production of estrogen and progesterone. And number 5, theoretically, if you're using growth hormone and this is helping the response to gonadotropins, other gonadotropins, you might be able to use less FSH and LH if you're using growth hormone. So maybe you could save cost in some of the other IVF medications that you're using. The practical hope is that for women, especially poor responders and diminished ovarian reserve, is that adding growth hormone will improve the number and maturation and quality of eggs, improve the number of embryos, and of course, improve clinical pregnancy rates, live birth rate. That's what you really want to know, that if you're doing an IVF cycle, you're hoping to improve the chances that you're going to take a baby home in your arms. Growth hormone was first studied in use in IVF way back in 1988. And since then, there have been several studies looking at it in multiple different ways to see if it could be helpful with IVF. And those are the studies that we're going to go over today. So let's get to those studies. First, we're going to talk about using growth hormone in normal responders, and then we're going to talk about using growth hormone in poor responders. So there's 2 main studies that look at combining evidence and trying to answer the question, does human growth hormone use in IVF help patients with normal response? So normal AMH, normal antral follicle count, good responders to IVF protocols. Should you add growth hormone in these particular situations? The first study that we're going to look at is Morad et al., and it was published in 2025 in the Journal of Human Reproduction. And the title is Empiric Use of Growth Hormone in IVF is Useless, the largest randomized controlled trial to date. So the answer to the question is in the title, but let's still go through the study anyway. The objective of the study was to see if growth hormone could help in normal responders. The patients included were from Montreal. It was a clinic called the OVO Clinic in Montreal. This is a phase 3 randomized controlled trial. 288 patients were included. 144 got growth hormone and 144 did not. All the women were aged 30 to 42. And the average AMH was 2.5. Average antral follicle count was 15 antral follicles between both ovaries. So these were good responder patients. The growth hormone group received daily subcutaneous injections of 2.5 milligrams of growth hormone from day 1 of stimulation of the IVF protocol through the day of trigger. And the results were clear. Growth hormone did not improve outcomes. Live birth rates were the same. Average number of eggs retrieved, maturation of eggs, number of embryos across the board. There was no statistically significant improvement in IVF outcomes if growth hormone was added to normal responder patients. Another study looked at this too. A Cochrane review came out in 2021. A Cochrane review is a highly respected mechanism for looking at multiple studies, randomized controlled trials, and trying to correlate the data together to answer a clinical question. So in this Cochrane review, they collected data for over 16 randomized controlled trials, which included over 1,300 women. And they tried to answer the question for both normal responders and poor responders. When they asked about using growth hormone in normal responders, they got the same results as the study that I just shared, that truly using growth hormone in normal responders did not improve overall outcomes. The Cochrane database does recognize that the individual studies that were used were pretty mediocre quality, like low numbers of patients. They talk about how when you're trying to compare studies, when people use different criteria for patients to include, or they're using different levels of growth hormone, or they're using different protocols for as far as when to start the growth hormone, it's really hard to make conclusive overall data. But they really do conclude that from the data that's out there and available today, that you really can't say that using growth hormone in normal responder patients is going to improve IVF outcomes. Now, they did look at this for poor responders as well. This is still that same study. It's the Cochrane database. And they included 14 randomized controlled trials with 1,200 poor responder patients. Poor responder was defined as 2 out of 3 criteria, either age over 40, number 2, a previous poor response to stimulation, or low ovarian reserve parameters like an AMH less than 1.1 or an antral follicle count below 5 to 7. And they found that the picture is much more encouraging that growth hormone might actually be helpful for poor responders. They found a higher clinical pregnancy rate, so odds ratio 1.85 over 11 trials and about 1,000 women included. Number of eggs retrieved was higher. Number of mature eggs retrieved was higher, and even a higher live birth rate was seen with an odds ratio of 1.77 over 8 trials. Now they are very cautious at making an overall assumption that every poor responder should have growth hormone added to their IVF protocol, because they really talk about that even though these are randomized controlled trials, that they're very small numbers, they're very different from each other, and that the evidence they're including is not extremely strong. But in general, when you compile all of this data, there was a slightly higher success rate when poor responders were given growth hormone in their IVF protocols. So there's 2 more studies that I want to talk about for using growth hormone in poor responder patients. The first is from Fertility and Sterility, published in 2020. The first author is Cozzolino. And the title is Growth Hormone Co-Treatment for Poor Responders Undergoing IVF, a systematic review and meta-analysis. The objective of this study was to systematically review and do a meta-analysis specifically focused on poor ovarian responders and to evaluate whether adding growth hormone improves IVF outcome. And their primary goal, what they wanted to look at, was, does it improve live birth rate? Because there's some suggestion that you might get more eggs. There's some suggestion that there might be more mature eggs and more embryos. And even some studies have shown a slightly higher clinical pregnancy rate. But what you really want to know is there a higher live birth rate? Is there a higher chance you're going to take a baby home if you add growth hormone to your IVF protocol? So the patients included, it was 12 randomized controlled trials. It was over 1,100 patients classified as poor responders. 586 of the women got growth hormone in their IVF protocols, and 553 did not. That was considered the control group. Studies were published between 1991 and 2019, and the definition of poor responder varied across the study, but in general was, like we talked about, like advanced reproductive age, a history of low response, and low AMH, or low number of antral follicles. So what were the results? Higher egg numbers, more mature eggs, more embryos available. Really was a meaningful difference. All of these things were statistically improved if you added growth hormone. They even saw a higher clinical pregnancy rate with an odds ratio of 1.34. That means that there was a 34% higher chance of achieving a clinical pregnancy if you added growth hormone in these particular patients compared to the women who did not. However, live birth rate, which was the outcome that matters the most, and that's exactly what they were looking at, that was only included in 5 of the studies and about 600 patients total, and there was no statistical difference. No higher live birth rate if you added growth hormone in poor responders. So all of this, these positive things, like seeing an improvement in number of eggs and sort of maybe that initial positive pregnancy test, but overall, the most important thing to look for is live birth rate, and it wasn't seen. There is one more study to look at. This is from Liu et al. It was published in 2025 in the Journal of Assisted Reproduction and Genetics. The title is Growth Hormone Improves Pregnancy Outcomes in Poor Responders Undergoing IVF. It's an umbrella review. So it's a little bit of a different way of looking at a lot of these studies. It's looking at a bird's eye view of the studies. It's not the same way as a meta-analysis, but it's an umbrella review. The objective, again, was all the same. Let's see if growth hormone can help these poor responders in an IVF cycle. There were some secondary things that they wanted to look at as far as like the dosage of growth hormone and the timing of use to see if that was any different among the studies. So it's kind of interesting. So what was included in this umbrella analysis? It was 12 systematic reviews and meta-analysis, which included 20 total randomized controlled trials and a total of about 2,000 women, and all of the women were classified as poor responders. Primary outcomes they were looking at was live birth rate and clinical pregnancy rate, and then other outcomes were IVF outcomes like number of eggs, number of mature eggs, number of embryos, and they did show a statistically significantly higher live birth rate in the growth hormone group. So this is the first time that one of these big meta-analysis, this is called an umbrella review, did show, looking at multiple studies, a slightly higher live birth rate in poor responders that used growth hormone for their IVF outcome. The odds ratio is 1.8, and a 95% confidence interval was 1.22 to 2.64. So when the confidence interval does not cross 1, that means it's statistically significant. So comparative, a really higher chance of live birth, which is pretty amazing. The clinical pregnancy rate was also significantly higher, odds ratio 1.92, with a confidence interval of 1.51 to 2.43. Other outcomes were higher too, like number of eggs, number of mature eggs, number of embryos available to transfer, and interestingly, a thicker endometrial lining, which was important, especially if someone was planning to do a fresh embryo transfer. They also found that the total number of gonadotropins used or needed in order to even get more eggs was less in the patients that used growth hormone. They found that the optimal dose was 5 to 10 international units of growth hormone per day, and the optimal timing was from the middle or late follicular phase through the HCG trigger, so during the stimulation phase. They also found that age matters. If you looked at different age groups, that the people who benefited the most were poor responders over the age of 40. They were looking for adverse outcomes as well, or adverse reactions for the patients that used growth hormone. And the only thing that was really reported was erythema, or a little bit of redness at the injection site. So the author's conclusions are that growth hormone in this particular overall umbrella review did improve a lot of outcomes in IVF, not only how many eggs, number of mature eggs, number of embryos, clinical pregnancy rate, but also live birth rate, again, in this one particular group of studies. The authors recognize again, and I'll keep saying this, that if you piece apart the individual studies, a lot of them are not consistent, like in how they use growth hormone, and a lot of them are consistent in how they define poor responders, and that the evidence, if you piece them apart, is not very strong evidence, but they're trying to extrapolate data and put numbers together to see if there's a difference, and when you do it this way, they did see it. So takeaways, what do you take away from this? This is very interesting. Growth hormone biologic possibility is found throughout their reproductive tract. If somebody has a low level of growth hormone, they have fertility issues. If you add growth hormone, especially to poor responders and especially of advanced reproductive age, it seems in some studies to improve outcomes. So you got to remember that this might not be right for you. You've got to talk to your doctor. I'm glad you stuck around to the end. I think that it's really interesting topic. We're always looking for ways to improve outcomes with IVF. I think that there are some things to weigh, the costs and extra injection with growth hormone, trying to understand if it's right for you. So if you are thinking about this, I want you to ask your doctor some questions. Number one, what do you think about adding growth hormone to an IVF cycle? Number two, do you think in my personal situation that it might benefit me? And number three, does the cost and the extra shot, is this something that really might be beneficial in my personal situation? And if we were to do it, how would you recommend that we do it? What would be the protocol and how would we use it in my IVF cycle? I hope this information was valuable for you. I hope you really learned something today. Like this video if you learned something. Comment with questions that you have. Be sure and subscribe to this channel so you get weekly videos all about reproductive health and more. And until next time, stay brave and curious.